Thank you, everyone. Welcome to the Board of Health meeting of May 19th. It is 6:02 p.m. Sorry, let me just admit somebody here to the meeting. So, let's see, sorry. All right, so first item on the agenda is that anybody on that wishes to participate in the citizens participation? Okay.
Di, just one question. Well, I don't know if it's the appropriate time to bring it up, or even if we can, just to inform everybody about the smoking things. Can we do that? I know it's not on the agenda, but that's going into effect on the 1st.
Oh, that can be made as a public announcement anytime anyway.
Yeah, I just didn't know if it was, that's why I figured I would just mention it now, just if we would need to review that, or just want to at least mention it to, the people and vendors about the, the tobacco regulations.
Updated tobacco regulations, yes.
Yeah, it should be June 1st, right?
Yeah.
Ron, if I may, Diane, to Ron, June 1st is the start date. It really, according to the state, they have till the 13th of June. But okay. I have been going to the stores, letting them know deadline is June 1st, and most of them are preparing for it.
Okay. Yeah, I didn't. Yeah. Okay. That's it.
Okay.
Yeah. Thank you.
All right. Ed, do you want to start out with the COVID-19 update?
Sure. So it's been a busy couple of days, everybody. First thing I did want to let everyone know, the small outbreak we had at 50 Higley Road, the New England Center for Children. All those students have been cleared now, and the New England Center for Children, we were in contact with them today. They plan on moving all those students back starting tomorrow. They also have a plan in place where they've already tested and retested all of their employees for that facility, and they sent us the actual testing list, which the dates and their actual results. They plan to do continual testing of their staff and students moving forward. They have multiple facilities throughout the area, not only in Ashland, but they've been really great to work with over the last couple of weeks. An update on Waterview Lodge, everybody. As most of you know, we had 3 patients initially last week, went out from the 3rd floor. And if you remember, the outbreak was on the 4th floor. We worked with Waterview Lodge last week, and they submitted their paperwork to get the National Guard back in, and Laura was really helpful. We made some phone calls and we got them moved up on the list. So National Guard was there on Saturday at 12:30. They tested the entire facility. What the outcome was what was interesting was everybody on the 4th floor that was positive is now negative, but now we have 18 positives on the 3rd floor. Of the 18, 16 are asymptomatic, and the other 2 have very mild symptoms. So they're being followed. Again, not sure how, I can only guess, did a staff member maybe from the 4th floor go to the 3rd floor for some reason? Yeah. It's one of those things we'll never be able to try to figure out. But I got to be honest with everybody, since we had that initial conference call with DPH and Waterview Lodge, their communication with us has been excellent. They actually call me every single day. I get a call from Dutch, the administrator, with updates. Any paperwork we've needed from Maven, they've been very quick to fill out, and we're using the school nurses and Nancy Cleary to enter the data in.
And so I was going to say, Ed, if I can add to that, I have to say that I really appreciate Millpond seems to be stepping up to the plate and sending us emails.
They've been continuously updating us every week on the dot.
And I know that us as a board have had some issues along the way, and I just wanted to publicly recognize them that they really have been working with us and notifying us with this.
Yeah, they've stepped
very
up
much appreciated.
They've taken up their responsibility very well.
Right.
So So that's the next thing I was going to talk. So Millpond last week also had all of their residents and staff tested. We found out yesterday, everybody in that building tested negative, including all the staff. Next update, the residents at Valley Farm. All the residents that are there still have now tested. I mean, we haven't retested, but they've all come out of isolation. Nobody has any symptoms. There's still 3 of the residents that were sent out to the hospital have been moved from the hospital to a rehab. So they're hard to follow, but otherwise that building is now clear again as of today. So Amy Childs, the nurse that we assigned to that, cleared the last patient today. So, and again, they were all isolated to that memory care unit. So that's kind of a quick update on our facilities. I do want to let you also know that most of us participated yesterday in a DPH conference call at 10 o'clock about the reopening phases. We didn't get a lot of information, but it was enough for us to get started. But I wanted to let you all know that we have been very aggressive already in the last 2 days, making sure our Ashland businesses and houses of worship are on board with what they need to know and do. So yesterday, I had Laura, we actually, and it's part of the packet tonight, everybody. We sent you a copy of what we sent all of the churches and synagogues and on what they need to do. So Laura actually reached out to every single one to send them the guidelines and make sure they understood them and phone numbers in case they have any questions. Beth Reynolds today sent out an email, and there's now links on the website for each type of facility, their guidelines, what they have to follow, and a checklist. Also, there's a survey that Beth sent out as part of that link, so that that way we have a way to acknowledge that each business has received the information, knows what to do. So she's going to keep a tally. That way, if a business doesn't fill that out, we're going to kind of know which ones we need to go after to make sure they have all the proper guidelines. So that's been ongoing for the last 2 days now. We're making sure we're getting all that information out to our businesses. So another piece of good news today, we had 0 new cases today, which I thought was great. So our numbers from yesterday are exactly the same. We didn't have anybody else that we could clear today, but we're going to work on more tomorrow. But you see our numbers we're definitely clearing. We're much higher now. I think yesterday we were at 135, I think was the number, with a total of 208 cases. Again, just I can kind of open it up to questions. I just wanted to give you guys a quick overview of what's going on.
Thank you, Ed. Anybody have any questions for Ed?
I don't have any questions, but what I'd like to say is, since you have stepped in to help lead the COVID team, I think the information and the data has been phenomenal. So thank you very much.
Thank you.
I
Thank
echo
you.
the same feeling, Ed, here.
Okay, Mark, do you have, sorry.
Yeah,
I was just going to say, Mark, do you have anything or you wanted to add, or is that pretty much?
I'm sorry, I forgot 2 quick things. I'm sorry. Also, just an FYI, for Mark, Mark's been doing the inspections. If what we've done, just so you know, I had Mark create a spreadsheet so we can track dates of every inspection and what he found. So if any of the board ever has a question on a particular building or a particular business, they can contact me or Mark. We're sharing that spreadsheet and we can give you the dates that we were there and any complaints that we received and why he went, things like that. And then KG, I just want to let KG asked me a question the other day over the phone. He wanted to know how many residential care facilities we have in town. We do have quite a few. Most of them, there's 4 or 5 that are run by the New England Center for Children, couple from Advocates, and a couple from the Brandon House. So again, if you guys want information on that, just let me know. Just so you do know, the fire chief does do a check-in with all of these residential facilities every Thursday. And I do have a running report of what's going on in those facilities.
Every Thursday now, and every year that he does it?
No, he does it every Thursday. They've been doing it for quite a while now, more since the COVID, but we do have running dates every Thursday.
So essentially, we have records of who they are and facilities are. That's what I wanted to make sure. Okay, as long as we have that record, we can follow up if need to be.
Absolutely.
Judy, did you have a question?
More of a comment. I don't know if you all remember very early on when I got on the board, I was talking about in California how they rate restaurants A, B, C, D. And I really like the philosophy of that. So you know how they rate with the local board of health. I'm not advocating for it. I wish we had it, but as far as Mark going into the grocery stores and compiling a list, is this something that we should open up to the public? Like, not a complaint, but if a complaint is substantiated when you get to that grocery store and they were told to do something different, I'm not sure of the legality.
But I think it's a good idea. I mean, I haven't seen any models.
I want to know as a
but
personal, somebody who shops, I would want to know how Shaw's doing. How's Market doing?
We could put that out as a future rating system and making that
if it's
public.
of any comfort, I had suggested one based on the number of certified food managers as well as anti-choke personnel in the.
That's for restaurants.
Yes, that's right. And certified food managers also work in the shopping markets like Shaw's and Market Basket.
Oh, the prepared foods.
Yeah,
right.
and I was going to say, just so we don't get off topic, why don't we put it on maybe for the next agenda, and I mean, it'd be something we should talk about.
Definitely.
I would like that. Yeah.
This is something similar to what the Better Business Bureau does, isn't it? When you look up a business that's registered with the Better Business Bureau, you can see if there have been complaints against it, how they responded to the complaints, and you can judge what type of a business you're doing business with.
I'm sure that if we, put it out to the public how well our grocery stores were doing and started there and then went to restaurants at some point, that people would be more comfortable.
It sounds like a great project for you, Judy. I think it's wonderful that you're offering to do that.
I think Boston does that.
I'm happy to start. I just need a little team.
Exactly. That's right. You can do the first draft, right?
Okay, I will.
So I just want to get back to Mark. Mark, I didn't mean to leave you hanging. I didn't know if you wanted to add anything else for the COVID-19.
You want that other piece of corn or no?
Where'd he go?
Just have to unmute. Sorry.
There you go.
about that. Well, first and foremost, my compliments to Ed too. He's been a beneficial addition to this whole situation. And again, he knows I can't thank him enough. Thank you, Ed. As it relates, well, it's well deserved, Ed. As it relates to general overview, I've been on the DPH conferences. We had another one, teleconferences this afternoon. There's still more information coming out, guidelines, directives from the state related to town meeting, elections, camps, pools. Unfortunately, they don't have it in writing, but they are working on it. They have some guidelines. Different agencies are now working on the various reopenings, including the Department of Labor and Standards at the state level, as well as of Environment and Energy and Environmental Affairs. So I heard that this afternoon, and I'll start researching their websites with Ed. And again, it's a work in progress with the state, and their most concerning matter is looking at is what Ed's doing, looking at the numbers to see if there will be any increase in the cases. And if there's not as many increases in the cases, then what will happen is they will in turn continue on with phase 2, then phase 3 and phase 4. But they're going at the rate that they feel is appropriate to keep everyone safe. So I have to say that they seem to be handling it very well. It's just a matter of getting that information out. The campers are anxious to know, the parents are anxious to know, and unfortunately, we don't know yet, but as soon as we know, we'll disseminate that information.
Ed, I just had one follow-up to, to the opening. Not that I certainly want to get anybody, in trouble going to a place of worship. And especially with this being phase one, are there any measures in place where people are at least going to be potentially checking on capacity versus the amount of people that are in these places, just to see if they're at least, kind of trying to, in good faith, follow the guidelines? I'm not saying it has to be exactly 40%, but I know that's what the guidelines stipulate.
Yeah, it's funny. When I was thinking the same thing. There was no guidance there on how to, who's going to check, and I think
I know you don't have time to do it all. I think people have to self-police, but
right.
Yeah.
You know what'll happen? I'll tell you that the tattletales are out there. We'll get a call, and that's how we'll know to go check.
Okay.
So
we're already getting them.
It's a shame.
Is there a sign out in front of a church or a synagogue that says capacity 500 and 40% of that is 200? So no more than 200. There's nobody counting like at the grocery store.
Yeah, well, so like on their building permits, that they'll have the capacity.
Right.
Again, and like I'm sure like that, if you think of St. Cecilia's, they'll probably have a pew, and then they'll have a pew sectioned off that you can't go in, and to keep that 6 feet apart, and
What kind of authority? I mean, we don't have enough police officers in the town to go around to every place of worship.
Yeah, exactly.
Right.
Well, we may suggest it to the facilities to put those information out there, so it may help them to control on themselves, because people may understand what it is.
Well, that's in the checklist.
Okay.
That's in the checklist. Yep.
Yeah, those were very specific.
I think Jen has something.
Yeah, I was gonna say that was like a segue over to Jen. Thank you.
I just want to be clear. So we were on a call yesterday, and we're certainly trying to figure out how we roll out these guidelines and people start to reopen. But as I understand it, the police are not the first line of enforcement for these type of complaints. So they really want any information to come to the local boards of health. They also talked about state agency. I think they had said DLS, which is Division of Local Services. And so because there's a prescribed sort of escalation, and many of it is about education. So I think there is at least 2 or 3 steps where you're educating people about, separating people by pews, 40%, how you safely move people through the building the most safely. So it's really incumbent upon local boards of health. So it would be really, Ed and Mark sort of going out there and educating people. And then we can turn it over to the state. But then after those educational sort of step ups on the level, then you can start to potentially, then there's a warning, I believe, and then there's a fine. And it's a non-criminal fine. And so they really thought, when they were explaining to us about enforcement, they really don't want this to become a police matter, or sort of that being the first where people first call. Now, I think those calls will happen because people, when they need assistance or need help, or they're feeling unsafe, that's who they've been trained to call, which makes a ton of sense. But in terms of these type of guidelines, where they should really be calling the Board of Health.
It may be worthwhile getting a general email or a status from each one of those large facilities to see what they're doing about it, and then you get like what we're getting, a report from Millpond or the other places, so we can just ask them to send one.
Right. So they're all required to have a safety plan on hand, so that if we did have available to anybody who, so if we get a complaint and Mark goes out, he can ask for the safety plan. It has to lay out how they're all in compliance of all of the guidelines. And so every single business, and I don't think they exclude the places of worship for that, have to have that on file.
Sure.
And Jen, if you want to touch base on it, I was going to say, and then with us for the town, Ed is working with Joe Richardson on a reopening plan for our municipal buildings and our municipal properties for that matter. So we don't really have a lot to report, I don't believe, Jen, right now, but.
No, we're still working through some of the logistics of what we will need to comply. You know, we will probably slowly open buildings. Haven't seen a written proposal as of yet, but working with Lisa in HR and Joe Richardson, who is our director of facilities, sort of thinking about what our staff needs to feel safe to do the sort of face-to-face transactional encounters, as well as sort of what we have to do, if anything, for our physical layouts. And we may sort of slowly open, you know, we may open by appointment only initially, and then sort of start to like roll out with the phases and be a little bit more open and accessible. But we do understand that there, you know, folks have to do business with our staff and our departments face to face. But we're also hoping that we can make it easier to do some of this transactions online, and so we can also walk people through. We've been doing that all along, and so hopefully people have gotten used to that, but there's certainly things that you have to do by coming into the building, and so we're trying to accommodate that as safely as possible.
Waiving the convenience fee should have helped. That was good.
Yeah.
Okay.
Sorry, Mark, I don't know, Mark, are you trying to get in on another screen? Okay, I just wanted, sorry.
He's muted.
That's okay. He just came in on another computer. I'm just a little confused. I wanted to make sure it wasn't him and not somebody else.
He's all pervading.
I know. All right. So if everybody's all set with the COVID-19 update.
Thank you, Ed.
I'm leaving.
Thanks, Ed.
I'm leaving. Call me if you need me.
Bye, Jen. I assume you're leaving too.
Enjoy the rest of your dinner, Ed.
All right, thanks.
right.
Bye.
Bye. Okay.
There he is.
Mark, you all set? Okay. All right. So Mark, we're going to move on to community garden. Do you want to do a quick?
He's muted.
I was just saying it's easier to use the laptop. You can press your bar button to unmute. It's so nice when you're on.
Thanks for the tip. I didn't know that.
I didn't either.
Space bar and it will, if you hit your space bar, it'll unmute you. Hold it down and then you can talk and then you lift it up.
Well, you just muted yourself again.
Mark, I just wanted to see if you want, do you want to give a just an introduction to what we're talking about for community garden first and then the farmers market?
Oh, sure. Yeah, I see Flo and Rob and they're live.
Yeah, hi.
This Zoom stuff's great. And they've asked for the board to consider looking at their platform for this year with COVID-19. So they are here, both of them on the same screen. I think that's pretty neat. And so it's okay, Diana, I'll ask that you allow them to present.
Absolutely, good, yeah. Rob, if you're all set, and Florence?
You know, if Rob and Florence need any documents, they live across the way from me. I could just shoot it as a paper airplane and probably get it right into their.
I'll stand by the door.
I was gonna say, talking about airmail, right?
Well, yep, I'm on, right?
Well, yeah, Florence, just hold on one second.
Sure.
Judy, did you have a question?
I have to disclose I'm a sponsor of Farmers Market.
That's okay. That's okay. That's okay. We're all supporters of it. Sorry, Florence, go ahead.
We're going to be talking about community garden first now?
Yep.
Yes. Okay. So I'm not sure what it is you need to know, but because I know that you received what I have here, high technology, so you can see, this is the map that we have that tells all our potential gardeners when they can actually come to the garden, so that we will never have more than 15 of our about 57, 60 families in the garden at one time. So 15 people can be in the garden at one time. And we've given everyone a color-coded team to be on, that identifies different hours that they can come in every particular day. So that's what we've got.
Okay.
So go
I was
ahead.
gonna say, my understanding, if I understand it correctly, and please correct me if I'm wrong, because there is a lot of information coming out that as a community garden, you will be allowed to operate as of the 25th, but as of right now, the municipal properties are closed until June 1st. Is that correct?
As far as I know.
Okay, well, I didn't know if,
We're not using it, that's for sure.
Yeah, well, right now, everything is closed until June 1st. So are you asking the select board tomorrow night to open up early?
Oh.
That was my understanding of this letter, and maybe I misunderstood.
We were going, well, I thought we were dealing with Michael Herbert.
We were told.
Okay, well, we won't address what they're doing tomorrow night. We can address this.
Okay.
No,
So
we
it
had
looks like to
discussions
me,
with
so the
Michael, and
color
Michael
coded
has
is the
sent us
second plan.
Hello, can you hear me?
I have a question for Laura. Was that paper given to us
Yep, you should have received everything. Did
today?
everybody get it?
It has a date of May 10th on the top of the letter
Right.
and then attached.
I was gonna say, I can literally go like this just so everybody can see.
Right.
Is
You
that
should
the
be able to
best
share.
that I can do? I'm
You should be able
improvising.
to share it, Diane, on the screen as a document with your controls.
KG, did you not get it?
I don't remember it, but it's fine.
Well,
Was it sent today?
No, it was sent last week.
Okay, just
You
a
know
quick overview, KG, what it is.
That's
just
fine.
because you can't see it. and
I
don't know how to
understand.
speak.
I have spoken to Florence before, so not a problem. I
Okay.
understand. their
Okay,
issue.
so you're familiar with what they're proposing.
Right, but I didn't see this plan, but it's fine.
Okay.
That's fine with me. I'll go
So
along with it.
the idea in the map is that no two gardeners are adjacent to one another at any time. So that we will maintain this more than 6 feet separation. We will,
Oh,
there you go.
Hey, there you go. Thank you.
Chris.
Thank
So
you.
we have 4 different colors, 4 teams, and you can see that, for instance, the yellow group can come at between 7 and 8 in the morning to water plants, whatever they need to do. They can come back at 11 o'clock for an hour, and they can come back at 3 o'clock from 3 to 4 for an hour. And in between those times, the green has an hour from 8 to 9, 12, etc., and the red and the blue. So it's from 7 in the morning to 7 at night. And if anyone can't make all those hours or any of those hours in their group, they can come take a look at who is there, count how many people are there, make sure that no one is adjacent to them, and come into the garden before 7 in the morning and after at midnight. Right. So, but everyone will be wearing face coverings or masks at all times. They are required to bring gloves and hand sanitizer and soap and wipes or a washcloth for hands. We are not providing any of the tools that we have shared in the past. No fertilizer, no compost, no tools like
Watering cans.
anything.
No watering cans.
Yeah.
No wheelbarrows, nothing.
Nothing. The shed will be locked up. Everyone knows that. And gardeners will be required to bring their own this particular year.
Florence, is there a number limit to, like, if, say, for you have, I'm just going to grab one here, Marcia
Wiles.
So if her and her husband and 3 kids come, I don't know who she is, I'm sorry. But is there a limit to how many people can go, or?
Yeah, we prefer that one person comes. However, if more than one comes, they have to look around and make sure that they're not exceeding the 15 number.
That's the standard number that derived out of the area?
We determined that it would be a safe number based on the square footage of the garden, based on what the algorithm is for the state.
Okay, so it follows the guideline. Okay, that's fine.
Absolutely, yes.
It looks very professional.
It is.
Well, we worked hard at it. Really did a job.
Florence and Rob, so my understanding also, I think you did a great job and obviously put a lot of effort into a plan, which is nice. So you're looking for the blessing of the board.
Yes.
Looking for the blessing from the board about your plan.
Yes.
And then you have a select board meeting tomorrow night. Right?
We have submitted it to Joe Richardson, who's given us our blessing. So I guess you've probably seen his email. And we've heard from Michael that he thinks we can open on June 20, on May 25th.
Yeah,
So
so
that's what we were
Go
told.
ahead, Jen.
We're hoping that.
right,
that's-
so we got, receiving the guidance yesterday that allows open spaces in parks to be open. We're going to work to open those parks, which obviously would allow the community garden to also access their area as long as they comply, which certainly it sounds like they do with the
Right.
guidance that was put forth.
Okay.
Excellent.
Yeah, Diane, can I just chirp in here for a sec?
Of course you can, yep.
So I was just going to say the community gardens is not specifically on our agenda tomorrow night. They did present 2 weeks ago, but given what Jen just said, I think the premise is that as we reopen, that community gardens will be one of the earliest opportunities for town property to be
Right.
used, right?
Yep. Thank you for clarifying that, Steve. So does the board members have any questions?
I have no question except that I advise them to be cautious about the issue of the mosquitoes if it does come up.
In terms of the spraying of the mosquitoes? Or
There was some news about it from Mark. Mark, maybe you may want to chime on that.
we're interested.
KG, every year we get ready for the mosquito season. They're larviciding right now, and we're hoping that we don't have triple E this year, but it does come in cycles of 3. So we are preparing for the potential, but right now we're at bay.
But our garden is completely organic.
Excuse me.
We stay away from any of these special sprays. Even we hope that the people that do the fields don't get too close to our garden. We've been very conscious of that, and we hope that doesn't happen. We don't want to have spray coming on top of our veggies that we don't know about.
Definitely. That's good, Rob.
I move that we endorse the plan as presented tonight by the Ashland Community Garden.
I second that. It's a wonderfully thought out plan.
I think it is as well. I just have one question on why you put the common area and meeting and educational talk area on this. And,
No.
and
It's been there for 9 years. We left it alone, but we're not doing any of that this year.
Okay.
Nothing, that's off limits.
Okay.
Diane? Did she disappear?
Sorry, no, I muted myself. I'm sorry. I was gonna say, yeah, we got a second. All in favor?
Hi, Chris.
Hi, Judy.
Hi, Rob.
Diane.
Can you take that down now, Chris?
There we go. All right, so moving on, Steve.
Thank
For the
you.
farmer's market and the same
Nice
thing
job.
for the 2020 season and procedures.
Yeah, good. Thank you, Diane, and good to see everybody tonight. I probably speak for a lot of people that were kind of, I'm getting tired of Zoom meetings. The only best thing about Zoom meetings right now is I've got a dog lying on my feet. I don't have at town hall, but Diane, I did send out 2 documents. One, a very short PowerPoint, and the other, a list of vendor rules. And I don't know if you can put the PowerPoint up, but if you have individuals have copies of it, we can just really quickly go through it. Rob is going to
Thank you, Chris.
Chris, you're the
help
best.
me out with
I
this.
know.
But thanks, Diane. So Rob will help me out with this, but basically we have been planning this for the last month, and we've been taking our guidance from the Department of Public Health that has put out a communication, the Massachusetts Department of Agricultural Resources that have put out a variety of guidances. We've worked with the Massachusetts Farmers Market Advocacy Group over the past month, and then We've also met recently with Mark Oram and Ed Berman at the site to review our plan as well. So Diane, if you can go to the next slide for me. So obviously this is the site of the Farmers Market, 125 Front Street. One of the guidances from MDAR is, in terms of layouts for farmers markets, is to attempt to do that in a straight line, given the need for social distancing. So if you can go to the next slide, Diane, and I'm going to let Rob speak to this.
Chris has control.
Okay, Chris, sorry.
That's okay.
I can take the credit.
I'm going to let Rob speak to this slide here, because just as he did with the community gardens, he put a lot of time and effort and work into creating this layout. And I'll let him describe that. Rob?
They're muted.
Yeah. Rob Muhlenbeek?
Okay.
Ready.
I'm here. Okay. So this is a one-way layout. We usually have tents on both sides of the farmers market. This time we only have the tents on the roadside, and not only we don't have them in the grass anymore. We have the tents actually on the parking area, and we have set it up so that the vendors can actually park in between the tents. So that way you have the whole area with the parking area is filled up with either tents or trucks for the vendors. So that we plan to actually close off that area so people will not be able to enter from the roadside. So they can only enter from the beginning of the community parking lots. So then we have two different major aisles. One is called a passing lane, where people go and walk down the farmers market, and then they can go and shop at each of the vendors, and they can stop and turn around in the exit lane if they want to. We'll have the lanes marked on the field, and then so people can shop and stand in line. We will have the lines marked for the places people to wait, and there's plenty of space, we think, for people to wait. And there's actually, we have 4 marked, but it looks like when we measured it, there might even be room for 5. But I mean, we have 4 marked on this plot. But so this does limit the number of vendors from what we usually can put out at the farmers market. So we have only like 17 positions, and maybe like 22 or 23 vendors that can actually attend, this season, which are all our major vendors that we usually have all the time. The other couple of things maybe that we can mention is that we will have a porta potty for the beginning of the season. When the library is not open, that will be in the parking lot, and we'll have some place for people to wash their hands near the porta potty. And I think that's about it. And we'll have monitors. We have the market host of the market manager at the beginning of the market. You can see in yellow, and people will be controlling the number of people that will go into the field, so we don't overflow any of the lines. We probably have a monitor somewhere halfway down the field that will watch the lines and make sure that things don't overflow.
Good.
This is about the layout. So,
good. Thank you, Rob. Chris, can you flip the next slide, please?
Sure.
So as Rob was describing, what we're trying to eliminate is any parking other than in the primary municipal lot, so that there's one entrance and one exit that leads into the lot. And so what we intend to do is mark out spaces to create the social distancing in front of vendors, as well as, if necessary, if we have to have a waiting line out before the farmers market entry, we could do that along the sidewalk that leads into the grass area. So I think from the feedback we received from Mark and from Ed, we had plenty of space there to create sufficient social distancing. We, as Rob just described, we're going to have sanitizing stations available. The porta potty will have a wash station there as well. So if you have any questions at this point, we can entertain them.
Steve, I have a question. Is there going to be an appropriate number of handicap spots closer to the entrance?
Yeah, what we're going to do, Chris, because the 2 handicap spots that exist right now are on Front Street.
Right.
So what we will do is we're going to identify, and we're going to be working with both with DPW on a variety of levels here, because we're going to identify 2 handicap spots right at the where the market host tent is, and we'll provide a ability for any of the usage to be able to easily get into the market site. So it'll be the 2 closest spaces to the grass area. Okay, so if you could flip the next slide, Chris. And again, we're just going through what we're doing with social distancing. The tents themselves are going to be 10 foot apart. So they're 10-foot tents. They're 10 feet apart. Again, 1 dedicated entrance point and passing lane. We're going to use, I think, a combination of cones and barricades and field paint to mark social distancing points. We're going to just be flowing in one direction, pretty much like the supermarket is doing today. I mean, all the supermarkets have one-way aisles, and that's how we're going to lay this out. So we have a dedicated lane going in and a dedicated lane going out. We're going to have signage. We're going to, certainly encourage all the proper protocols, 6-foot social distancing. We're certainly encouraging masks. I'm not quite sure if we can mandate masks. I know there's certain situations where people don't have to wear masks, but and then so hopefully what we've also done, of course, and this is based on the guidance from the state as well. We only have food vendors. There's no artisan vendors this year. There is none of the extra amenities that we've always done as a farmer's market. There's no music, there's no kids corner, no community service tent, there's no food sampling, there's no touching of food by customers. So, a lot of changes. It should be very similar to, an experience getting out to the supermarket. So Chris, I think the next slide, unless I'm done here. So we sent a document as well, and I'm going to let Rob speak to this one. We spent a lot of time putting together a list of requirements for our vendors. And most of this was culled from guidance from the state, as well as what other farmers markets are doing around the state. And we've been on a number of Zoom meetings with other farmers market around the state. And so this is we've got an extensive list of requirements for our vendors. So Rob, you want to speak to this one a little bit?
Yep, you.
Well, I think this is just a summary, of all our vendors rules. We have almost like a page and a half of vendor rules.
Read them all, Rob. That's what we want you for. No, I'm just kidding.
So I don't want to go through all of these, but I think.
How far back, the 2 tables?
Yeah, we're maintaining the social distances between the vendors and the customers by suggesting that they have an extra table in front of their tent. That's one thing. We're planning to have a sanitizing bottle on each of the tables. We'll have signs on each of the tables for customers, so that they don't touch any of the food. There will be no sampling and anything. So you just point at the food that you want, and the food will all be behind the tables. So I don't know what else was.
I think once again, I think you obviously put a lot of effort into the plan, and it, you know, it shows that you guys put a lot of thought into it.
I have one question. The
Go ahead.
porta potty that they have, is that handicapped convenience also, or
It would have to be, right?
Say that again?
porta potty that they have that a handicapped person can use it too? Is that appropriate size?
So the porta potty will not be handicapped accessible for the one we hire. It's a big expense for us to hire the porta potty, but it will
Only for the use of.
it'll only for the vendors. Oh yeah, and it'll be locked.
Yeah.
We will. This is the important part of the porta potty. We will lock the porta potty so only vendors and staff can use it. It will not be for the customers. So this way, it will be easy to keep clean, and you know we'll have some supplies to clean the handles and wash hands nearby. But this is the only way we can maintain a clean environment, you know, during this time of the farmers market. And we will close it. We will close it off so that it cannot be used when the farmers market is not in session. So.
Is there a requirement of providing one?
No, it's not, KG. We've never had a porta potty.
Oh, okay.
We normally don't have a porta potty
because
anyway.
the library was open all the time. That's what
Right.
So we're doing this short term until the library is available until that point in time. So
You know,
I think this is our presentation. I mean, we're obviously looking for your blessing on this, your vote of support, and any other concerns that you have, that anything that stands out for the board members that you think we've missed or we should enhance.
I'd like to say that, again, this is just yet another very exhaustive and very detailed and well thought out plan. I think that some of the challenges that you will have as managers of the market and the challenges that the vendors are going to have is, you know, there's such a rich history now to the farmers market. This is what, year 8?
Yes.
Right? So in the first 7 years, the farmers market is a community gathering that happens to be a place where people shop. That's how I've always interpreted it. That's what it's been to me. I've never gone to the farmers market for shopping. I've shopped because I happen to be there socializing with my community.
It is Ashland.
Yeah. And it's a beautiful, beautiful thing. And we hope that sometime in the future it can go back to that, but we've got to bridge this gap and continue it. So I think that obviously there are things that we have no control over and that you guys have no control over. You can't control how many people are going to show up and how many people are going to shop, but never more than ever do we need the support of the community to go out to these vendors and shop and support them, because we need these vendors to have a reason to come back and to show how much we appreciated them showing up during this very difficult time. And as long as whatever it is that we can do to support those vendors in this environment, in this very difficult environment, we need to really, really pay attention and listen to them and do whatever is necessary to show them how much we appreciate them going through this with us.
Yeah, I appreciate hearing that, Chris, because obviously a farmer's market's become, just the integral part of our community life. But I think you raised the real essence of this, which is the support for the produce vendors, for the farms, for the food vendors, for people that have put their heart and soul into creating their products. So, I think I hope we get back to what we all enjoyed. I hope we get back to going out to restaurants and to do all the things that we love to do. But it's really going to depend on the whole health scenario. So
Well, hopefully we're getting there, right?
Yeah, definitely. All these social activities will improve everything. That's good.
Yeah.
Okay, does
Okay,
somebody,
Thank you very much.
Thank you.
okay,
Chris,
does somebody want to make a motion as we did
Well,
with each
I
meeting?
make a motion that we approve this plan as presented.
Yeah.
I'm sure
Nice.
they will have their own ways to improve it if they want to,
So,
as they learn more.
I second that.
Thank you, Chris.
I-
All
I
in
ju-
favor?
Oh, sorry. I just wanted to mention, by the way, that because of this situation this year, we are actually hiring 2 professional employees to help us out this year at the farmers market. So we want to make sure that it all gets run properly and that they have, that we don't have to go from week to week with different market hosts. So there'll be 2 dedicated employees that will take care of the farmers market. The other thing we're doing for the vendors is we're going to have a Zoom meeting with all our vendors just before the farmers market. After we get approved and all that, we will have a Zoom meeting with all our vendors to explain all this and make sure everything will.
Kudos to you. Two less unemployed persons.
I love
Okay,
the farmers market. I can't vote on this because I'm a sponsor, but
You-
you
I
have
was
my
gonna say-
heart.
And
I
your
was gonna say,
sponsorship has nothing to do with it. You can. You're not getting benefit out of this.
You're not.
I
You-
don't think I should.
We have enough to pass.
Oh,
the vote.
sure.
Yeah.
Sure, definitely.
Okay,
Judy,
go
I
ahead.
appreciate that because I don't vote on farmers markets activities when they're in front of the select board. So I get that.
And I respect it as well, so.
Yeah.
Okay, so for the other members who are voting, because we have a second, and all in favor?
Aye,
Hi,
KG.
Chris.
Aye, Diane, and Judy is one of.
Abstain.
You guys have too many scruples. You should vote. That's what it-
I think my vote was my check.
That's
Yeah.
right.
Steve,
Nate.
I just had one question just regarding the bathrooms. Is there, a town ordinance, or is the library not able to be opened even just for the facilities? Or was that discussed, or is it
I
just not
think
possible?
Jen is probably, if Jen is still on the line, she can speak to that. But, I know that, again, it's part of the whole reopening plan. And
Understood.
knowing the library, it's going to be a challenge to keep social distancing there.
No, yeah, you would have to have
But I'd like-
somebody that
We do have a
would
question.
volunteer to kind of enforce things a little.
Sure.
We do have a question about whether the police station will be open for use of the bathrooms there.
Are you asking for the farmer's market?
I'm asking if it would be open and available to people to use, not for the vendors who will, have something, but for other people coming through. Is that something that we can refer people to if there is an emergency?
So as we sort of work through reopening, we can certainly consider that. What a lot of the guidelines, at least in the phase 1 and 2, require daily cleanings of the bathroom. So right now, we are working towards. So right now, we have a cleaning service that isn't necessarily every single day, just based on our usage. And so we have to work with our cleaning contractor to see how many days that they would actually be able to clean. Anything open to the public, especially restrooms, you have to be cleaned several times if you're opening like restrooms in open spaces or parks. It has to be cleaned several times a day. And so that's certainly something that we're looking into. We just don't know if we have the capacity to keep up with, continue to comply with the state guidance. So that's something that we've been starting to research as we're looking to reopen our buildings.
And you can let us know if that's becomes available.
Yes.
Thank
And then
you.
in terms of the library, we'll obviously do a very slow reopening. There may, they may just start with curbside. So that building would actually not be open for people to come into, but we'd still be able to provide books and other materials to people. So again, we're going to sort of slowly step our way back into being open and more accessible to the public.
Florence, I think that it'll be less of an issue with the format of the farmers market this year because it's not a place where people are coming to hang out for a couple of hours.
Linger.
It's people are coming in, walking through a very direct line, do their shopping and leave. So I don't think it's going to be as much of an issue. It'd be nice if we did have a place where we can refer if someone has an issue, but I think it'll be less of a problem this year than in past years.
I agree.
I would agree with you, Chris. I think, we've all been going out to supermarkets, and I think at this point, I think people are kind of in that rhythm of waiting in line and keeping separated and doing their shopping quickly and getting home.
Yep. All right, if everybody's all set, we're gonna move on to the next agenda item. We have a couple people that are waiting.
Good.
Sure.
Thank
Good
you,
job.
everybody. Appreciate it. Thank you. Thanks for the
Thank you.
support.
Thank you,
All right,
everybody.
no problem. Take care. Have a good night.
Thank you for all your work.
Bye. Thanks.
Okay, Mark, so I think you said that, is Henry Hayes, are you here, part of the discussion for irrigation?
Yeah.
Okay.
Yep. I here as representing Delbrook JKS, the general contractor performing the work over at Robert Hill Way.
All right, do you want to just give us a
Yep.
quick,
Sure. Why don't I? This is Joe Henderson here.
Hey Joe, how you doing?
How you doing? Why don't I give a quick overview, and then Henry can chime in on any specifics we want to do for regarding the well. But
Yeah,
Okay.
Joe. Joe. The Justin from Riverside Services, also who's our landscaper, and will be involved in drilling the well. Is also on the call. Just so.
perfect.
Just so I know, is that who's on the Galaxy S8?
That's me. Yep.
Oh, great. I just want to make sure I knew who was on. Thank you.
So why don't I just do a quick intro? My name is Joe Henderson. I work for Horsley Witten Group. We are the civil engineers for this project, and we're representing EA Fish Development, who is developing the Robert Hill Way development located off Independence Lane. We're here to ask the board to consider our proposal to install an irrigation well. The plan for the well, I don't know, does everyone have a copy of the plan or can see the plan? Okay, perfect. So the well is located in the kind of the southwest portion of the property. Great.
Thank you, Chris.
So you can see just a general overview on the bottom, and then the upper left of that plan shows kind of a zoomed in area. The well, so right now the development is under construction. Phase 1, which is 64 units of age restricted housing, is currently in progress, and they've got a lot of the utilities and roadway built. I've shown on the plan the phase 2 building and phase 2 parking area, just for to give you an idea of what else is going on out there, and to kind of give an idea of what we're looking at as far as locations for the well. We've located it outside the 100-foot buffer to the wetland to the south of the property. We've also located it approximately 24 feet off the building, and there's also some sewer collection system there. We're about 30 feet off that sewer manhole. This site is serviced by the town water and town sewer, and also I believe the surrounding Independence Lane area is also on town sewer and town water. The nearest property line to the well is to the south, and that is approximately 215 feet away. The nearest property line that has a residential area is to the west, and that I believe is Garrison Lane. That is approximately 350 feet away from the proposed well location. And just to give some frame of reference, from the well out to the Independence Lane Road is about 500 plus feet.
I just want to say, Mark, so my understanding from this, because it's been a little while since we've had one of these, that the reason why it's in front of the board is because it's the property served by town sewer and town water and our regulations. Am I understanding that correctly?
This is part of it, yes. It is serviced by both water and community sewer, municipal water and sewer. Under our well regulations, if someone's wishing to put in an irrigation well under section 312.6D, they would have to come to the Board of Health and ask for permission, since it is basically not allowed without the board's permission. So they're here tonight to request permission for the irrigation well, and they do have to explain how by putting in the irrigation well, it will not affect any other water resources within the area.
Okay, so we would be giving them a waiver to the, and just for clarification, for internal purposes, we don't have a letter requesting a waiver, correct? Mark, you're muted. Hold on. Go ahead, Mark. What? Mark, we can't hear you.
So we have a rule 312-6D against irrigation wells unless we approve them. Is this residential or commercial or both?
This is residential, only residential.
And so why do we as a whole prevent them?
Okay, it's a prohibition. The board has to review. Can you all hear me first of all?
Yeah.
Okay.
Yes.
Sorry about that. I'm trying to go between screens on the regulation as well as on the Zoom meeting, and it actually knocked me out from using that space bar that I thought would work when I was doing it. So what they're doing, it's a prohibition unless they come to the board and seek your approval. And they have to indicate that by putting in the irrigation well, they won't be drawing on other water resources. So say if there was a town well nearby, that could possibly affect a town well. If there was a water recharge area to a town well, that could be another issue. If there was a farm nearby already utilizing an irrigation well, then that would have to be considered. So I believe the engineer was going to present the effects of the well in respect to water resources within the area.
So I guess my question, Mark, and thank you for the response, but I don't think you hit on what maybe I wasn't clear. So we have water bans every year, but if you have a well, full disclosure, my place does, you need they're prohibited unless they're permitted, correct?
That is correct.
So is there really a way to tell whose water I'm affecting if I stick a well 500 feet down in the ground? Do I really know who I'm affecting?
Usually if there's a water resource in the area, they have zones of contribution. And I think Joe is going to go into that a little bit, where the zone of contribution is a drawn out, either a radius or an actual study of that well output, as well as where it's drawing from. So in this case, the engineer will have to provide information that we are not affecting any water recharge area or another well nearby that might be drawing water, such as the well at your location.
So is Southborough, which is very close to this location, is that, do they use water wells or do they have public water?
They have public water. They're on the MWRA system. And in fact, we draw from them when we will have to draw from them when we need water. The town has an agreement to draw from a Southborough line because of the fact they have MWRA water at their location.
So Joe, I was gonna say, Joe, I'll give you, get back to you in 1 second. So I just want to make sure that I understand, because some of the members are new and this is a little bit different for us.
Right.
So my understanding is the reason, because the property is serviced by town water and town sewer, that's why we have to give them a variance from the section of the code. If they were on septic and town water, would we have to do the same?
Yeah.
Mark?
Yeah, 1 second.
But if they were on town water and there was a watering ban, they couldn't use it, correct?
Well, correct, but yeah.
That is something the town would have to consider, because people with private wells can use them during water bans, because they're
We have not regulated that. This was a
Okay.
discussion in town meeting a couple of years ago.
All
but
right, so.
we never went through it.
That is correct. And the
And I,
state
and,
is also looking at it.
and I apologize, I'm beating a dead horse here, and then I'll get to Joe, I promise, but, so what triggered it coming in front of the board versus you approving it?
Well, under chapter, if I can read the section, it's chapter 312, 6D. It says wells used for drinking water and domestic water supply shall not be used to provide water for groundwater, heat pump systems, or for water cooling or conditioning systems or irrigation. Any well used for such systems shall be approved by the Ashland Board of Health only after the applicant has submitted with sufficient evidence to the satisfaction of the Board of Health that such use will not disrupt any quantity of water from any nearby well, and that the well will satisfy the manufacturer's recommendation for proper equipment operation. So that's how it's worded.
But
And
haven't you been, and again, I know this is too much now, but like you can approve the wells. Why do we have to give this one a variance?
this one specifies that it needs Board of Health review.
Yeah, but that's what I'm wondering. What's the trigger?
The trigger is the regulation. It's not a generic well that I could approve. Any irrigation well goes in front of the board. We had the last ones were on the MBTA access road at Cirrus Apartments. And the board got very involved with those wells based on their proximity.
And yeah, and it's probably a regulation prior to me being on the board. So I apologize. I just want to just make sure I had clarification.
That's the only one of some of the ones, Dan. That is a good point you bring out. That is one of the very few that comes in front of the board. But I think the town actually has had visitors at the Board of Health meeting to discuss water resources. So it gives the opportunity for public discussion also.
Well, and this is just going back to Joe. I mean, we can, obviously we want you to continue your presentation, but I know that there's obviously a water pressure up there. So I'm very curious how that's going to be affected by this.
I have a question, Diane. There was an email from one of the local residents about this not being part of the zoning application or approved 40B application or something. Is that cleared through? Do we need to go and check with zoning board to make sure that that is in kosher with their regulations?
Mark has sent it to the appropriate people to review their aspect of it. I think we all got CC'd on it, but if not, I know conservation and I know ZBA, I believe, have to review it as well. So if the board votes to support this, then it would obviously have to be contingent on them getting all town permits.
That is correct, Diane.
All right, Joe, if you want to, I apologize for sidetracking, had to get some clarifications. If you want to continue, that would be great.
Sure. I mean, the only other thing I would add is that I did review the DP Title V area maps. I did not see any public water supply wells anywhere near this area. I have not done a hydrogeologic study of the well and the pumping rate and calculated the zone 2, but I expect, and maybe the landscaper can talk about the actual well pump more later, but I don't expect it to be a large pump that would create a large drawdown that would significantly affect the surrounding community, just because it is so remotely located from all the other homes around the area. Like I said, I think we're 300 plus feet from the nearest residence, 500 feet from Independence Lane, and then 200 feet from the nearest property line.
I have a question here.
Sure.
From the past experience with Cirrus as well as the one down near the Millpond, they had to come up with another well because the amount of water that they needed was insufficient for them. Insufficient for them. So do you a priori know how much do you need?
I don't
know. The system is the system is designed to run at 20 gallons a minute and 60 psi. So 3/4 of the system is drip irrigation, which is low water volume for all the plant material. There's very little grass up in that proposed building. It's really only around the backside.
So it's more for plantings versus grass?
Correct.
Okay.
Are you using like the technology for rain gardens and that type of thing and plantings that don't require as sort of drought resistant based on our new?
We do. We have bioretention areas for our stormwater treatment. So we treat the initial first flush water quality volume through the bioretentions, and then we pass the larger storms off to underground infiltration areas. So we are using the vegetative bioretention areas for all our stormwater treatment at the site.
Is there enough water stored somewhere in the ground?
It's not, I would say no, probably not. And I don't think, I'm not sure you could use the water that's in these rainwater systems for that purpose.
This will be a deep drilled well. It will not be a shallow well, so we won't be drawing from any of the upper surface waters. It'll be drilled into the ledge. That's all we allow within the town of Ash.
And again, I know I mentioned it, I'm sure everybody's well aware that there's a water pressure issue up there now, but that's not going to be affected at all from this well, correct?
Yeah,
no, this well.
Correct.
Diane, that is correct. That's the town water issue, not any of the.
I also understand from speaking to another fellow Conservation Commission member that when these applications were processed way back through the Concom, they had a restriction on no blasting or any other means by which you could crack the rocks underground, which may divert the waterways from the wetland areas. Is that precaution taken care of here?
Yeah, so there was a conservation requirement so we had to hammer with a rock hammer all the rock that was on the site. So there was no blasting done. The well will be drilled with much less force, I would say, than the rock hammers were to the site.
You won't have to frack. You won't have to frack the well, or?
I don't believe so. No, it'll just be drilled into the bedrock, like Mark said, and I don't know exactly what depth it'll be at. I think the parameters of the well will be kind of figured out once they figure out how much water is there available, how deep the rock is, how much rock there is.
You don't anticipate for another request for second well if this?
That's always a possibility, I think.
Yeah.
It is a possibility. This is Justin with Riverside, but Henry and I had the conversation today. Right now, the irrigation system is designed to water the landscaping at 20 gallons a minute. So in the event that we drilled down, say 500 feet and didn't get that 20 gallons a minute, we would have to go and probably redesign our irrigation system, add more valves, less heads on a zone to work within the parameters of the well, or drill a second well. But I mean, we really don't know that until.
Right.
Do you have an alternate? Do you have an alternate location for a second well scoped out?
I don't, because I'm hoping that the first well produces the water that we need.
Correct.
Mark, do you obviously recommend approval of this?
Yes, I do recommend approval, but I would like a letter from the engineer stating it's not affecting any other water resources.
Are we going to get some documentation on it? Supporting documentation?
I would ask you make that part of your vote and decision that you.
Well, I was just going to say, I think a letter letting us know what the variance requested and the reason being, and maybe just itemizing, and then I think that would be sufficient.
Sure. Yeah, I didn't realize there was a variance involved, to tell you the truth. So I would have normally gone through the normal procedures. I apologize.
No worries. Yeah, as long as you just follow up, but then you can always email something over to Mark just so we can have for the file, and then just with the supporting.
Shall we wait for that letter, or do we vote on it now? Because they're not going to dig it tomorrow.
Comfortable with voting on it. I mean, it's just a letter. I mean, I think verbally, I mean, he gave us the information we need to move on. And then, I mean, if there's other information we need, we're meeting in 2 more weeks.
What's your timeline on this?
We're looking to drill the well by the end of May, so within the next 2 weeks.
So when would it be functional if you drill it in May? When would it be functional?
The landscape's going to start going in sometime in July. So I'd want to make sure it's in operational. We have to test the water, determine if there's any filtration that needs to be done. So I want to get all that stuff figured out before we actually start running the well.
Okay. So, well, we're almost mid-May and you want to do it at the end of May. I don't know if that's going to be possible unless you have all the documentation. I think as long as an engineer puts a stamp of approval on this is not going to affect anybody else's water supply or anything that would be a negative effect. And Mark, we'd have to look at you, towards you for, you know, sort of educating us on what we should be looking for. But I think as long as we know that it's not going to harm anybody's water supply, that's what we need.
Well, I was gonna say, I think Joe did state that, so I think as long as he just follows up with something in writing, I would feel comfortable with it.
And I think you're talking about the 312.6D, right, Mark? That's basically the section that you want us to verify?
It is correct. You're following that protocol within that. So basically the regulation sets the protocol within that section. So that's what you would actually follow.
Was that part of their application request or they're adding it?
So what we did was we added a note to the plan that does say the proposed irrigation well location is in compliance with all state and local requirements.
Right.
Will that be sufficient?
Would you have them list whatever those requirements are?
I was just gonna say, Joe, if it's not too much, if you would just put a letter maybe to the board, just referencing the request for the vote. I mean, obviously it's gonna be after the fact, and then just maybe list down the reasons. I mean, it's kind of putting the cart before the horse or vice versa, but just reiterating what you mentioned and just to have something in writing.
Yeah, and also make a list of what all those compliances are.
Sure, yep.
That would be great.
Mark, who are the other boards that need to vote on this before it can go through?
It should be conditional of the conservation review and zoning.
Okay.
And we might want to just generalize it, say all other town departments, just in case, you know.
Town department and regulations.
Chris, you're going to make a motion?
Sure. I move that we approve this plan contingent upon receipt of the letter from Mr. Henderson and approval by all other relevant town departments and or agencies and or boards.
I second that.
Any further questions?
Yes, this is Henry. So is that approval from the other boards, and Joe would hopefully have that letter over to you guys later this week. But the approval from the other town boards, that wouldn't be until your next meeting, or when do
So after we take the vote tonight, I suggest you contact conservation and the zoning board or the planning director and just touch base with them, make sure that there's no other further requirements that are needed from them.
I did talk to the conservation agent and I mentioned it to Megan, and she said that as long as we're outside the 100-foot buffer, there was no issue on her end. But,
okay.
Get an email from her and make sure it is documented.
Yeah.
And also similarly documented from the zoning board. And you start digging only after you get the approval from the zoning board.
Understood.
Okay. I just want to call for a roll call vote. All in favor?
Aye, KG.
Aye, Chris.
Aye, Ron.
Aye, Judy.
Aye, Diane. Okay, guys, so the variance has been granted, and Joe, if you don't mind following up with that letter and just checking in with the other departments, and you should be all set.
All right, great. Thanks everyone for your time.
No problem.
Appreciate it.
Very
Thank
much.
you.
Have a good night.
Thank you so much.
Incidentally, I have a question for Mark on this well issue. You know, the Cirrus Apartments and the Lantern on the Woods, as well as the senior housing near the 55 and plus near the Millpond area, all of them said that they will send their test results. It has been more than a year. We haven't seen any of those things. Are you following with them, or what's happening with it?
Yeah, it's Sarah said had to get results yearly, KG. The others do not. And Sarah did.
No, Lanterns and Wood also promised it because they were all pouring it on the lawn, and then we did suggest that they have to go. They did promise. I know that.
Well, I'll check the record. I know Sarah definitely has to do it post-in-pre.
Right. What's wrong with them? They're taking more time.
No, they have.
Well,
they
I was gonna say, yeah. Why don't
follow it up and then try to get us the results if you can.
Okay. All right, Mark. Moving on to Item number 7, it's the health agent's report, which is the budget update.
Yes, just so the board knows, budget line items are in good shape. Obviously, our recruiting funds aren't being utilized as we have in the past because of COVID-19. We're not out there with tobacco inspections. I'm handling that while we're waiting for things to recover, but we will be seeing an increase in inspections as we get through this and no protocol. And at the salary line item, we're at 90% where we should be. And all the other line items you can see are in good shape. I know it's hard on Zoom, but if you have any questions on any of the line items, please let me know. I'd be glad to go over that with you.
No, it looks good. Thank you.
Okay. All right. So the next item on the agenda is Meredith Daly for an internship.
Yeah, Diane, she happens to be listening in.
Okay.
I don't know if she can hear us, but I see she's muted. I don't know if Meredith did indicate that. Hi,
Yep,
Meredith.
there she is.
We have never met in person, so nice to meet you on Zoom, Meredith. She was going to explain to the board, if it's all right, what her considerations are. Diane, just so you know, I did explain to her, due to the COVID-19 situation, that this is not a typical year, and that most of the work, if anything, may have to be done from a remote area. So as we're doing on Zoom right now. But
right, and just to update, I mean, Meredith, nice to meet you, and also the board members. I did speak to Mark, and there's the town is working on the reopening plan, and we're not currently accepting any type of volunteering. So with the reopening plan, I did ask them to consider an intern or any type of a volunteer, so we can help Meredith. And I know Mark is nice enough to do this, but with everything going on right now and the sensitivity of people being in the building, even just a reopening plan, we need to just put it on hold. Might be just a couple of weeks. We'll put it on the agenda, maybe for the next agenda as well. So we'll meet Meredith, and then once we find out how the town's reopening plan is, whether we have Meredith back at the next meeting or Mark communicate with her. It sounds like, I'm not too sure what phase we'd be able to bring Meredith, in or on, but we'll have to work with the town with that.
yeah, and Diane, if I can, I did ask Meredith to give a little overview of what she can do outside of town hall. She's looking at working on 2 projects. One is Nyanza, the other one is the pandemic itself. And she was going to give an overview of what can be done remotely versus at town hall, or even possibly working not just with our health department, but with others. So if it's okay, I'd like to maybe give Meredith 5 minutes to overview.
Yep, just hang tight for 1 second, Meredith. Judy, did you have a question?
So I'm hearing that, we're having trouble opening town hall. And hi, Meredith, nice to meet you. And I'm sure this is going to be a very rewarding experience. But my concern is that you might have your hopes up right now, because I'm not really sure if we're going to be able to do an internship this year. I mean, we don't even know if half of our employees are going to be back working like they're supposed to be working. So I just feel that we're putting the cart before the horse. I'm happy to listen to you, but I certainly don't want to get your hopes up right now. And I just kind of don't know if that, how the situation is right now, or what we're going to be able to do or not be able to do going forward.
I respect what you're saying, but I think, like Mark was saying, there's probably a lot of things that she can still learn remotely without specifically being in the room with Mark. And I know everybody's having to make concessions. My daughter in her 3rd year of medical school had all outside rotations canceled. She already had 3 out of state. They're all gone. So I'd like to help out the young lady, and I know if Mark's willing to do that, even if it's not an optimal internship, even if it all has to be remote, I still think she would gain a lot out of it, which is the whole point of everything, right? And she'd still have Mark to guide her, a health agent for whatever.
Right,
I don't want
just
to say how old you are,
respectfully,
Mark, 35
we had
years.
But for Ron, excuse me, I mean, we had to bring on more staff to help us. So, I mean, I don't want to talk about Meredith like she's she's sitting here, but we had to bring on staff to help us with our current situation because again, this is stuff she's probably gonna put in her report is it's a lot of work with what's going on. So that's another concern of mine, but let's not, again, the same thing. We kind of have to, we want to talk to Meredith.
I've got an open mind to it in the future, but right now I think, you know, if Mark has any extra time, we had to bring somebody in to help, you know, get through this part of it. And if he has extra time to be working, and you know, I've worked with interns and I support them, and I'm on a board at Framingham State, and I can tell you this is my big love. But right now I feel that Mark's probably got enough on his plate without taking an intern on.
I can, since you mentioned my name, let me explain it. I've had more on my plate than you can imagine over the past 8 years. She'll be the 8th summer intern. And if there is a concern, because I know this year is very unique in respect to time, I will use my own vacation time to take care of it.
Yeah.
All right, with that,
If I can just take 1 second, Diane.
Sure.
And I want to hear very much from Meredith. I work in higher education, and there's no bigger advocate for higher education than I in this room, perhaps. And I completely understand Judy's perspective. I'm very glad that Ron said what he did. And I think KG will back me up too. He's worked in higher education as well. I think we're in a very unbelievably and unique situation right now. And I think as long as we can follow the parameters of what an intern is supposed to get for their program, and we're following protocol of the state, we're paying attention to the rules of the state and the ordinances of the town. I think that I would personally like to defer to Mark, who's been in this position for decades, and has worked with interns, that if he feels that it's something he could take on and not take away from what needs to be done, and maybe even enhance what could be done, and Meredith would not only have an enriching experience from having interned, but having interned during one of the most unique times in American history in this thing, she could probably come away with something. We could gift her with something even more than what she came for. And I would love to be able to do that if we can.
That sounds great, Chris, but I hate to like put I'm flabbergasted that we are having this discussion tonight. That's all I'm going to say.
Let me add.
I was just going to say, so just because I just want to make sure we're respectful, because I just don't want this to go south. Is that
right?
Let me add a sentence here.
Okay.
I know that I do love education, but I also prefer safety is important. So if current situation doesn't permit to be a safe environment for a person to get the education that they want, then we need to adhere to that safety issues, because life is important than education when it comes to life and education.
Sure.
Well, I just want to say, because we obviously all have our own opinions and we all feel strongly about them. I just want to say this. I apologize, Meredith, for having this conversation in front of you, because we're talking about you like you're not sitting here.
I know, I feel horrible, Meredith.
With that said, because clearly you can see the divide, if you will. So, and this is what a board does. This is why you have 5 members, is because we all have an opinion, and it's healthy. So with that said, why don't you introduce yourself and let us know what's going on?
Wonderful. And I just want to thank everyone. I've been listening to the meeting since it started, and this is, a great insight into what potentially I will be doing in the future. So just a little bit of background on myself. I'm a Master of Public Health student at Boston University. I'm also a lifelong resident of the town of Ashland. So this is kind of near and dear to my heart, I would say. So I have 6 years of prior career experience before I've gone into this master's program. I worked at a local healthcare software company as a project engineer and integration design manager, and more recently at a large academic teaching hospital as a project manager in performance improvement. So I've kind of pivoted a little bit. I've been afforded a great opportunity to attend Boston University to get my master's. And one of the driving forces for me to go in was kind of the knowledge and background of, you know, the Nyanza site in Ashland. I'm going to be focusing on health policy and law and environmental health. So I think that being able to intern in Ashland would just be an amazing opportunity to really kind of bring those two things together with not only Nyanza for the environmental health side of things, but also the current situation that we're all facing right now with the coronavirus for the law and policy part that just plays such a big role in what's going on. So what Mark and I had talked about was doing, I think a lot of this work could potentially be done remotely, you know, sort of an impact evaluation analysis on the Nyanza piece. And then for the emergency preparedness piece, doing an analysis on current policies, practices. It's obviously a fluid situation, but I think a lot of the work, as stated before, could be done remotely for an enriching experience, sort of mutually beneficial for both the town and myself as a practicum experience.
Anybody have any questions for Meredith? No?
Yeah, well, I think she's right in what she said. I think, you know, both of those to, you know, revisit the impact of Nyanza and to review a preparedness plan, almost like she'd be performing a function, you know, that might not have all the things in place, you know, with somebody who's going to take an in-depth look at it for no cost to the town, and Mark willing to do it if he's willing to do it. You know, I think the young lady, like Chris said, could, you know, gain valuable experience, especially, you know, with in the background of this of the virus. You know, I'm gonna, you know, have an argument against the board. I respect everybody's opinion.
Meredith, when were you thinking about doing this actually over the summer?
Yeah, completing the internship.
Yeah.
Yeah, over the summer.
Okay, so I mean, is it like July and August type of a deal?
So it's a 240-hour practicum. That's minimum required by the school. So the timing can kind of be worked out, whether that's a 5-day-a-week thing for 8 hours or 3 days a week for 8 hours. It can kind of be what we need to make it.
What I was thinking, oh, sorry, Mark, did you want to say something?
No, I was going to say, and that's the way it's been the past 7 summers with the summer interns. But Ron, I just wanted to go on from where he was saying, what he was saying, and I think Meredith, she kind of indicated she's offering something to the town. I can say after 7 years of having summer interns, they offer more than we have to offer. They will be leaving, she'll be leaving us more information that we didn't have on Nyanza, as well as a good overview of the COVID-19 situation at hand. And she's doing that on her own, and I'm guiding her.
Well, and I know, and I have to interrupt Mark because I know, and again, Meredith, I apologize, but for you hearing this, I actually think when the COVID-19 is, I'll call it over, it's probably not gonna be over for a while, but when we're in a different situation, those things would actually be beneficial to look, what did we do? What did we do wrong? What do we need to change? And kind of look back and do something on that. But I think and again, everybody's probably going to agree to disagree, but I mean, Mark has had an intern for 7 years. This year is different from any other year. Here we are having a Zoom meeting, which I've never done this in 30 years working for the town. I would like, you seem wonderful. You seem wonderful on paper. You seem wonderful in person. I think it'd be great to have you do something for us. It's just a matter of how and when. So I think we need to see, we're literally working on a reopening plan as we speak. And I think we'll have to just incorporate interns into our plan. So I think we could possibly make it work. And I mean, we'd love to have the work, you know, done, but I just don't know when the timing is going to be appropriate. I guess is.
I think that's well.
Is the concern that Mark doesn't have the time to devote to this? I don't see the other concern.
I
missing it.
absolutely have a concern about that. Yes.
Okay.
I do as well.
He volunteered his own time.
Yes, I did.
I understand he
take
did
him at
that.
his
Then it's
word.
not a discussion that we're having up at the town of Ashland.
But if he does it on his own time, he can't do it under the town of Ashland that she interned for. It would be under Mark Oram, private citizen, correct?
And that would be fine, and I would work with my fellows from other towns to make sure.
So you don't need us to talk about that if you're going to do it on your own.
If the board so wishes to have it that way, then that's the way it will be. Meredith has a very important part of her life going on right here, and I would not want to interfere with not being able to help her.
Well, and I
And
want
none
to
of
again.
us, we all want to be able to help her, Mark.
Right.
Trust me. We
I
really
was just going to say, I want to reiterate.
Anyways,
and if
we'll
you-
work
if
on
you-
that on the outside. If the board so wishes for us not
Mark,
to entertain.
none of us have said that we do not want her to work for us.
Yeah, we do. Just
We
not
do.
right this
I'm
second.
just saying today, we cannot say that she can start working for us.
Right.
And
I think
if you and her decide to do
exactly-
something
you're exactly what
personally
we need.
outside of here, that's fine. But I think we should put it back on the agenda in 2 weeks and talk about it, because I think she has some great ideas, but there might be things that we should just add, like,
And I think the 2 weeks, with the town trying to figure out their reopening and figuring out, like, you said it's 240 hours. So how many hours do you actually need somebody to, like, mentor you and to kind of direct you and provide you the information that you need to do this?
There's no set amount of hours. It really is, what we make of it. If there are specific things that the town Board of Health would like me to focus on, then I'm definitely open to it. Obviously, we're in a challenging time right now, but it is, there's no set mentoring hours, if you will, that are needed by the supervisor.
Okay.
Sorry.
I would definitely like to say, I definitely didn't expect this discussion tonight, so I apologize if I'm coming off like I don't think this is a good idea, because I think this is a fabulous idea. I think your skill set and your background are extraordinary, and I applaud you. And I would love you to help us out. I just don't feel comfortable right now giving my blessing to anybody at Town Hall that's really working very diligently right now to just get through what we're getting through, to have to focus on anything else other than a very big task we have at hand. And in 2 weeks or 4 weeks, hopefully it's going to be a different story. I just feel like this is like just a bit premature for my own comfort level, if that makes any sense to you.
You said it right, Judy.
Chris, did you want to say something?
I did. I was going to say, if we're going to put this off to an agenda for another meeting, and part, or at least part of the concern is whether or not Mark has the time to handle this in his job, then I think that we should not only, obviously Mark has provided his input as well, but then perhaps maybe Mark's superior, Michael Herbert, we should ask for his thoughts on bringing in an intern too, since it affects his direct report.
Okay.
That's fine. And at our next meeting, I mean, Jen,
Or
appears to
Jen,
be
yeah,
coming on
exactly,
to ours, so we could do that at the next meeting. Meredith, you're more than welcome to join. If you don't have to, it's more of probably a town policy, if anything, because like I said, currently we're not allowing any volunteering under the current situation. So I'm assuming that's going to be part of the phased opening. So, I mean, like I said, you're more than welcome to attend our next meeting, virtually, but we'll put it on for the next meeting.
That's the 9th of June, is it?
I'm just looking it up. Sorry.
Sorry. Are there any other interns within the town? Like, I would imagine that it would probably be a good idea to have them. Are there any other? Okay, so can you make sure, like, when Mike Hebert is talking about the opening up plan, if he can figure out a way to fit in. I don't know, but I
Well, I
think
know
it's
Mark
gonna-
and I have emailed
We-
with management, so I think they
Okay.
clearly know it's on our meeting, so.
All right,
Let-
let's
let-
put it on the agenda for 2 weeks.
Let me also check with Concom. They usually bring someone, interns also. Let me check with them to whether they have one this year.
Okay. All right, great.
Can I just ask Meredith one, just her thoughts? But just a question, Meredith. With given the scope of this discussion, regarding time constraints and the seriousness of the phase of reintegrating, let's say, more normal life with COVID as it currently is, what do you think your potential time constraints on Mark would be? What do you anticipate the time that you would actually need to spend in the building? Let's say if we couldn't, because I'm not disagreeing with Diane or Judy at all, that, right now, there's limited access to town hall. Do you feel like you need significant access to that or significant guidance by Mark, or are a lot of these research things that you can kind of do on your own or get information offline? What's your feeling?
Yeah, I mean, I think a lot of it can be done remotely. I think one thing that Mark and I had talked about was the potential for shadowing, which Mark can go about his day-to-day business with me socially distancing, obviously. But, less guidance on that front would be necessary, but I think that's a big piece of the internship. But for the rest of it, I do think there's a lot of, research that can go into this. And if there's any way that I can wick away some of the work, if there's any low-hanging fruit that I could help take on, I would definitely be open to that too. Like I said, my background is in project management, performance improvement, that sort of thing. So I hope that I would be able to offer a lot to the town and helping out with any deliverables that are relevant.
And just one last question. Let's say this doesn't work out. Do you have any potential contingency plan? Because this is a requirement, I'm assuming, for your graduation, right? Your degree. You need to do this.
Right. Yep. This is a requirement for graduation. I'm planning to graduate next May, and usually the summer is the time frame when we take on our practicum. So
yeah, I would assume that would be the only significant chunk of time you would have. Right.
Diane, I have a question for Mark. Mark, when these interns do shadow you, do they shadow you on all types of work that you do, or only specifically related to their internship project?
KG, they shadow me on the variety of work that we do, the broad field of public health. They also shadow DEP and DPH at times. The past few years, the interns have also shadowed DPH and DEP through their internship with the town of Ashland, with our Board of Health. So there's a variety of shadowing. I'd say 50% of the job, the work they do, not job, it's they're interning. They're not anything more than doing that, is to shadow, and the other part is their project. In this case, Meredith chose 2 projects, which is we'll keep her busy remotely. And I would be more than willing to talk with her after hours from work, weekends, on my vacation time, anytime I can offer to her, I'd be willing to do it.
Right, but when you say remotely, that she has no access to any of the COVID data, which may have confidential information, so she may have to work on projects or subject matter which is outside that area.
She wouldn't be involved with any confidential
right, so she won't be able to shadow you in those cases. Yes,
I'd like to, I mean, if Meredith wants to, if not Mark, I mean, what exactly would you be doing with the Nyanza and the COVID? I mean, obviously the COVID, 99% of it is coming down from, the state. So what would you be looking at for, so to speak, our records for COVID?
Oh, Mark, were you going to say something?
No, I was going to let Meredith, she kind of went over this with me. So go ahead, Meredith. I saw you going to the point of talking.
Yeah, so what we had discussed briefly was looking into, I mean, I think a big piece is the relationship and kind of the collaboration between federal, state, and local, policies. How does it work in a time like this? Being able to analyze current policies and practices. One of the big things that we had talked about was the long-term care facilities in town. How does testing happen in these areas with regard to staff members, things like that. So I think doing some sort of analysis on how that would work, best practices, if, obviously it's changing day by day, but I think doing an analysis on kind of what the best practices are from the state level would be helpful in rolling out something to the local level. Being able to assist with that, I think, is critically important in a time like this. So that was just one of the items that we had discussed last week. Obviously, this is before the guidance was rolled out yesterday by the governor, but that was one piece that we had discussed.
Well, what you're talking about right now, Meredith, is under the sort of direction of Ed Berman, who you heard earlier in the discussion. Anything COVID relating for the Board of Health is 100% him. So what you're talking about, best practices in long-term care places, is what he's got his hands in every day, all day, and working real hard on that. You heard the report about the institutions earlier on in the discussion. So just the fact that part of your internship deals with that, we haven't even brought Ed into this discussion to see if he has the bandwidth for that. The other part, maybe Mark could help you with, but I know the COVID part would be definitely Ed Berman, who's in charge of the COVID for the Board of Health.
Well, and even with that said, I'm curious too about even with Nyanza, because, working for the town for a long time, and we've had this so much with the Nyanza site. I just didn't know what that project would entail for the Nyanza site.
Yeah, and I know there's a lot that's come out the past year, and there might be things put on hold depending on what happens with the coronavirus piece. But I think getting a better idea of, public comments regarding the proposed groundwater cleanup plan, and really understanding a path forward for remedial action and what a communication plan might look like to citizens in the town, things like that. Again, that is also probably somewhat of a fluid situation with other things that are going on, but
no, that's good. That's what I didn't know if you were moving forward. So
I think that part is completely handled by the EPA and DEP right now, because town is not directly involved in that remediation plans at all. They haven't come up with anything. And the town has an Nyanza committee which has not met for a year almost. And then they did come up with presentation about 6 months ago. Is it, Mark? EPA came up with a plan for injecting.
They met with us back in January, KG. So
no, there was a public.
Not the Nyanza advisory. He's talking about the Nyanza advisory. I think Ron.
No, not the EPA came up with a project plan for the future. They were proposing to clean up. This is just a preliminary inquiry by the EPA to inject some chemicals down the ground, drilling holes, and then clean up the liquid phase item there. That's what they were thinking of.
Chris,
so those are all being handled by EPA and DEP.
I have no doubt in my mind that Meredith could help us.
Sure.
With her skill set. I really think we need to talk to Mike Hebert and Ed.
So Chris, if you want to ask a question, we just want to move on, because me and my 8 o'clock by 2 hour window for
Yep. I'll be quick. But I think I have a suggestion that would be helpful to the board and to Meredith, should we be able to take her on as an intern. I think one of the things that we have been focused on as a board over the last few months is the Medical Reserve Corps. And it might be a very interesting piece of your project to look at what the Medical Reserve Corps is, how it impacts communities and the effect that such an organization would have on a community during a crisis such as this. Whereby that kind of information would be useful is, as a board, we go out into the community and say, we really encourage people to be a part of this Medical Reserve Corps. Here's the impact it can have. Now we can have some hard-driven statistics. And this might be useful to you too, because the Medical Reserve Corps is in 30 or 31 different communities across the Commonwealth, and many of the areas that are in your service area. So I think that's a great idea.
Chris, I appreciate your idea. I was thinking the same thing, because that's actually what we're lacking in right now as a department.
Yeah.
So you're probably thinking like we're turning on a dime on you now, Meredith, but let us give us some time. You hit us like head on tonight. I didn't know any of this was going to happen.
It's a good, this is experience number one, Meredith. You know what I'm saying?
I understand, Chris, but the only thing is that I don't know what she has already submitted as a project to the.
No, I understand that. I understand.
It all depends on that.
Level,
and those are things maybe we should talk about. I mean, we should talk about, as a board.
But I think that we all, after hashing this all out. Getting it all out.
It's right in front of you, Meredith.
Right in front of you. I think that for one of the things I think that we all agree on, Meredith, other than the fact that you're clearly a very bright, intelligent, wonderful person who can contribute greatly to us.
Yeah.
That we have to take into consideration what is important for us as a board, for our town, and for everybody's health, safety, and well-being, including yours. So I think that what we need to do is we need to regroup behind the scenes as a board and discuss how, if it's possible, to bring someone on as an intern safely, so that you can be safe, so that everyone else in town can be safe, and so that we would be able to use our resources most effectively and not take away from anything that are our responsibilities first to the town, for whom we have taken an oath for it. And if we can bring you in and not infringe and be able to take advantage of the fact that you can help us and at the same time help you and give you what you need, then I think that everyone on this would be right on board.
Yeah.
Yes, we would.
Yep.
Well said.
Absolutely.
Mm-hmm.
Well said.
Thank you.
So we will put it on the next agenda. Is that
I was
right?
going to say, and Meredith, if we, obviously if we get the information, we're going to pass it along to you as soon as possible. And we don't want to lose your interest either. And we would, like you to.
So here's what I need to know from Meredith. Oh, you just switched screens. So.
Just for the record, everybody did on mine. I don't know why.
I don't know why.
Give me a slice of that, please.
Is this something that you submitted to the school and this is what you have to work on? Or can we change it up on you if we can figure out, I don't even know if we can, but if we can figure something out?
Yeah, so the school is being very flexible right now, knowing that many internships, not just this one, are in flux. A lot of unknown out there. So what I have submitted to the school is still open. I would just need to put it through for approval again. So if there are other pieces that you feel are relevant, I don't know, Chris, if the medical corps that you were talking about is the same thing as the American Public Health Volunteer Corps. I was working with them for a little bit throughout the semester, doing some contact tracing in the city of Cambridge. So I don't know if that's the same thing or not, but either way, I am open to other suggestions if there's places I can help out. Again, I'm a lifelong resident of the town too, so I want to see the town, progress forward, and make sure that the residents are safe and healthy. So.
Ironically, I believe, Mark, correct me if I'm wrong, our last intern actually is working for the Medical Reserve Corps.
That is correct.
That's correct,
Yep.
yeah.
So we have a good history here.
Good memory, Diane.
Yeah.
Fine. All right, Meredith, if I have this thing about ending our meetings by 8 o'clock and we've been sitting here. So
Yeah.
you're more than welcome to stay on and.
All right. Well, I appreciate it. Thank you, everyone.
All right, we'll get back to you as soon as
Thank you very much,
possible.
Meredith. We'll be chatting.
All right. So moving on, for the review of the minutes, we have, Laura has asked if we take May 5th off, they're not completed. So we have the minutes of April 21st and April 28th. Do I hear a motion?
I'm sorry, I have not reviewed them.
Okay, we could. Would you want to just wait, we'll do it at the next meeting?
Yeah, I think that's what would be better.
Okay.
Thank you.
You want to?
So table for the next meeting?
Sure.
Thank you. I promise I'll get to them.
No worries, I'm glad you were honest.
Are we okay with the 21st for that first one for the time wise, to how long we have to?
We have to have it in draft form.
Okay. Okay, I just want to
Somebody
make sure that we're not
requested and Laura
violating
can
any.
always give them what we have.
Okay, just want to make sure that we're not violating anything.
No, no.
I appreciate that.
When's our next meeting?
8th of
June
June, I guess.
June 2nd?
9th of June, I guess, right?
3 weeks?
It'll be the 2nd, isn't it?
The 2nd.
Okay, 2nd.
Okay.
So with that said, so our next meeting is June 2nd. Of course, we'll do 6 p.m. As far as that, we'll go with the fact that we're going to be doing a Zoom meeting, which I assume will still be in that position.
Okay.
Just FYI, I am not available on the 16th. So if you guys want to meet, of course, if Chris is here, he could run the meeting.
Diane, I don't know if we can meet then. I believe that is town election day. Or maybe
Town election is the
19th, isn't it?
30th.
30th, okay.
Check the dates. I believe June 16th is the town meeting, and I believe June 24th is town
No,
election.
the 23rd is, excuse me, the 23rd is the election. And the 30th is,
Oh, okay.
oh shoot, you guys still see me?
I see it.
We see you.
Okay, I don't know what I just did, sorry.
Not sure what that thing that just crawled behind you is.
Could not be anything. But Mark, I will double check I cannot remember off the top of my head what. So with that said though, so the next meeting, we have the Mary Mortensen Public Health Award. Again, I don't know what position that we're gonna be in then.
Yeah.
We're waiting for a physical meeting to award it anyway, right?
Yeah.
Yes, yeah, I mean, they obviously know, and it's just a matter of, bringing them forward.
Has the
Dinner's waiting.
has the thing been engraved? The
No.
the plaque? Okay.
That's probably going to be August or September, Diane.
Yeah, I mean.
Yeah, we'll just keep it on as a future agenda. Anybody else have anything for the next, for the June 2nd?
I just want to get the water test results updated from those promised people.
Okay.
From Cirrus, Lantern on the Woods, as well as the
and
one next to the.
And Laura, I know when you and Mark do it, but we'll put we'll put Meredith for the intern. I mean, she might stay for the whole meeting, but we can put the discussion at the beginning. So.
Okay.
So how about talking about EEE and how our preparedness plan for that?
I'm just writing. Okay.
Yeah.
I'll go from pandemic to EEE.
Yeah, right. There you go. All in the virus mode, though.
Yeah, I know.
And hey, KG, just to your point, and I guess it's maybe for Mark, they have to submit quality results regarding the well to you prior to its approval. Is that correct?
No, it was approved because there are some chemical contaminants. We had asked them to submit it, and then the Lantern of the Woods, they did promise that they will do.
No, I'm sorry, I wasn't clear. I just mean on the new well tonight. They have to submit water samples to Mark, correct? For
after that, yes,
the same things like manganese,
that is part of the well installation itself. That any well they have to do it.
Okay.
It doesn't meet some basic criteria. Mark has the authority to stop it or not use it. He can close it.
So before we move on, I just want to say, because thank goodness for people out there watching our meeting, town meeting is the 16th. So Mark, you are correct.
That is correct, Dan. I just checked. It is the 16th.
obviously wouldn't be able to meet then, so let's just look at the calendar.
Well, we can see if we can maybe come up with a time at the next meeting. We'll figure out if
Right,
anybody.
yeah, exactly, yeah.
Yeah.
All right, does anybody have anything else? It's 8:01.
Diane, do you have time tomorrow to meet in front of the town hall? I have some more masks.
Sure.
Oh, I have about 80 of them, so I'll bring it down.
Wow.
And give it to you.
Wow.
Yes.
Awesome.
Yeah, I'll be there after 1 o'clock.
Yeah, I'll catch up with you on the phone. And
Okay.
I'll make a motion to adjourn.
Thank you.
I
I'm gonna
second that.
that motion.
Oh, too many people seconding.
All in favor?
Aye.
Chris.
Aye. Diane.
Good meeting, everyone. I like the
Thank
discussion. Very good. Very
Okay.
good.
Have a good night. We'll talk to you soon.
Yeah. Thanks,
Bye.
everybody. Stay safe.
You
Bye,
too.
Laura.
Yeah.
Bye-bye.
Bye-bye.
Yeah.
You
Good night.
have you have those
Yes.
couple of items for next